Good evening, Facebook. My name is Dr. Renee Davis, and on behalf of Brighter Horizons Psychological Services and Delta Sigma Theta Sorority Incorporated, the Gastonia Alumni Chapter, I welcome you to our series. This series is entitled Mental Health Matters. Today's topic will be on Mental Health 101. I hope you enjoy the information that will be provided for you. We have a wonderful presenter. Her name is April Holowka. She is a licensed clinical social worker in Charlotte. So on behalf of Brighter Horizons Psychological Services and the Gastonia Alumni Chapter of Delta Sigma Theta Sorority Incorporated, I bring to you Miss April Holowka.
First of all, before I get started with my introduction and who I am and what I do, I just wanted to say that this presentation is for informational purposes only. It is not a substitute for receiving mental health treatment. And so if you're experiencing serious symptoms, please contact 911. If you are in need of a referral or counseling, you can contact Brighter Horizons Psychological Services at 704-671-2381. So my name is April Holowka, and I am a licensed clinical social worker, and I primarily work in Charlotte, North Carolina. I obtained my social work degree, both my bachelor's and my master's, from the University of North Carolina at Charlotte. I've been in practice for a number of years working with children, adolescents, families, veterans, as well as adults. I currently work with adults that experience severe and persistent mental illness and assist them at getting housing in their community. I also have my certification as an integrative nutrition health coach, and I try to pair the education that I have there to help people to have more of a holistic approach to not just mental health, but health in general. And so that's just a little bit about me and what my credentials are. And so I am going to start this presentation off. This is Mental Health 101. And we basically are just going to give you a general overview of what mental health is, what services look like, and what things you can do if you find yourself in need of services or know someone who may need help as well. First, I'd like to talk about what mental health is. Oxford Dictionary defines mental health as a person's condition with regard to their mental and emotional well-being. And in general, that is basically how you function, how you deal with life, how you handle the things going on in your head and stressors from outside and various different things. And so mental health is about the state of health in your mind and your emotions and even your body sometimes. Mental illness is really more of when that is not functioning at optimal level. So we're really talking about when there's like some sort of disorder, when maybe routine sadness goes deeper. Or I like to use the example of someone who loves to clean. And you may be somebody who you like to go out and I'm going to clean my house, and it's a great stress reliever for you. You feel like your world is back in order and all is right with the world. And that's very different from somebody who can't leave their home because it's not clean enough, that they have to do things so regimented that they can't function if that level of clean is not there. So that's the difference between a healthy way of managing a situation and really a disordered way. And if I had someone who couldn't leave their house and couldn't go to work and couldn't take care of their family because they had to clean over and over and over, then I would encourage them to seek services. So that's the general overall of what the difference between mental health and mental illness is. A little bit of stats, and I'm only going to give you a little because I know it bores most people, so just hang in here with me. So 13.4% of the U.S. population identifies as Black or African American. Of those 13.4%, over 16% have reported having a mental illness episode in the last year. That's over 7 million people. And so it's not uncommon. It's not a weird thing for that one guy that you saw talking to himself on the corner. This is something that occurs. And I think that the rate is probably even higher, specifically for the African American community, because we don't trust the system. So we're not going out there telling people when we have issues. I mean, just honestly. And so I think, you know, based on the history we have with this system and how we've gone for help and been kind of bamboozled into some things, we don't always report when we're experiencing those things. So the rate could be higher, but this is the numbers that we have, and so we're going to go with that. The one thing that I did want to point out is that there are still biases in the system. For example, a diagnosis like schizophrenia, which is typically someone who sees or hears things that no one else sees or hears, it gets diagnosed far more in African Americans than it does in their white counterparts that exhibit the same symptoms. The white counterparts may be diagnosed with a mood disorder. And so that's where the bias in the system comes in sometimes, and I think that I'll get into some of those challenges a little bit later on. Causes of mental illness or mental health concerns. I think there are a number of them, and I think it's really important for us to look at the systemic things that are occurring around us. Like currently, there is such a climate of racism and violence against African Americans. And those stressors, people not having jobs, heck, the pandemic, being stuck at home with people, all of those things can increase the level of stress on you. Now, stress is not a mental health concern. Stress is a normal part of life. But when it becomes overwhelming and it overburdens you, it can lead to other diagnoses. So I'm going to go into some common diagnoses in a minute. Another area that I want to talk about in relationship to mental health is substance use. Now I know everybody's like, oh, don't get on my weed smoking, and that's not what we're doing tonight. But what we're talking about is not just substances that are not legal, but substances that even a doctor prescribes can cause you to have symptoms of a mental illness. There are diagnoses that are strictly induced as side effects of other medications. So sometimes you may go to the doctor for something medical, and the medication you take may cause you to hallucinate and see things. And you're like, oh, hold up, I never had schizophrenia before, but it's that medication. And so sometimes, just like with sometimes the medications on the street that are not legal can cause you to experience symptoms like that, so can just everyday medication. Brain chemistry. Now I'm gonna nerd out for you a little bit because I think that the brain is a fascinating thing, and it really ties together so many parts of your life. And so you have chemicals in your brains that regulate your emotions, and they regulate how you receive information and process and things like that. When those chemicals are off, you're off. It's as simple as that. And so I give you the example of a child that may have some issues with attention. They can't sit still, they fidget, they just, you're like, if you don't sit down somewhere, I don't care if they ran all day long, they're gonna run till they collapse. And it may simply be a matter of medication that you need to get to balance out those chemicals so that they can kind of focus and really be able to hone in. And it's the same thing for a number of disorders that are diagnosed. So that's a little bit on brain chemistry, but I'm not going deep because that's not really what I want to do. I just want to give you various reasons for why people can experience a mental illness. And the last thing that I'm going to talk about in terms of what causes mental illness is, and there are a number that I'm not even going to get to. I just wanted to highlight these four because I think that they're the ones that I hear the most. Medical disorders. Something that people don't understand is that if you have an untreated medical disorder, it can manifest in your mental health. And so I always like to go back to when I started out in the field. I had a clinical director who gave me a story of a child that he had worked with for years. And this child, the behaviors were out of control. This child raged and raged and raged, and they could not figure out why. And at some point, the child went to the doctor, and they found out the child had diabetes that was untreated. Once the child got treated, the behavioral symptoms went away. So don't be scared to take your information to your primary care doctor, because sometimes it's something that's medical and treatable, and it's not, oh, you're going crazy, because that's the thing that we in the African American community want to do. We want to just make somebody just it's done. You got bad mental health issues, we're going to throw you away. That's not necessary in a lot of cases, and in every case as far as I'm concerned. But I think that when we know better, we do better. And that's what I'm here for, to give you the information so that you will know better. So I'm going to give you some common mental health diagnoses. Now I'm not going to go into all of the symptoms for every single one of them, because I'm going to go later on to what some signs and symptoms of disorders are when you should seek help. So right now I'm just going to give you some names, and I'm sure some of them you are familiar with. So major depressive disorder, and most people know that by depression, schizophrenia, and bipolar disorder. Now I got to stop on this one, because bipolar disorder right now, I think of the commercial with the lady making the sandwiches. I don't know if any of you have seen that commercial, but every single time I think about a lady all night long making sandwiches. Okay, to me that minimizes the severity, and I know that they really want people to just seek treatment and to get the medication to manage those symptoms, but bipolar can be very, very serious. And so yeah, we all think about that person that might run around or be really, really depressed, and they're up and down. And so, but don't let commercials make you believe a diagnosis, you know what it looks like, because I don't know what every diagnosis looks like, and that's what my job is. So I think that you really, really need to go to a professional when you suspect something. So anxiety disorders, a lot of worry, a lot of things like that. Post-traumatic stress disorder, I know a lot of you have heard of that because of the veterans that are coming home and unfortunately not surviving a lot of times when they're experiencing those PTSD symptoms. And so I'm going to leave that to one of my colleagues to address trauma. And so in her presentation later on this month, I encourage you to watch so that you can actually find out more about trauma and how it really impacts people and families. And then obsessive compulsive disorder. That kind of was a little bit like my intro at the beginning about the lady who's cleaning or the person who's cleaning all the time. You can overdo, and you can become obsessive about things and have compulsions. And so that is a disorder that you really, when it really impacts your ability to function, you need to seek treatment for it. And then borderline personality disorder. And personality disorders are a little bit different. Those can't be treated with medication, but you definitely should seek somebody who is knowledgeable in treating that. Okay, so now that we've talked a little bit about some disorders, I really want to let you guys know what warning signs are. And I think for most people, you will be able to help someone that you care about, because a lot of times when you're going through it yourself, you can't see it. These warning signs, also, you've got to take them into consideration in the severity of them, okay? When I go through them, you'll be like, I've experienced that. I know somebody who goes through that. All of those types of things, okay? However, is it negatively impacting how you function? Are you crying so much that you cannot take care of your children? That's different than I felt a little down today. Okay, so that's what I really want to go into. Okay, so the first one, coincidentally, is feeling very sad or withdrawn for more than 2 weeks. Actually withdrawing, not wanting to be around anyone and not wanting to talk to anyone. Trying to harm or end one's life. That's a full stop. You don't need to wait and check that. You don't need to see if maybe I should do something about it. No. That is you go see someone right away, okay? Severe, out of control, risk-taking behavior that causes harm to you or someone else. So if you want to fly down the highway at 90 miles an hour and it puts you or your passenger in danger, and you want to do that a few times a week, just saying, you might want to get that checked out. A sudden overwhelming fear for no reason. Sometimes with a racing heart, physical discomfort, or difficulty breathing. Most people will go to the doctor for that, because anytime you have difficulty breathing or your heart is racing, you're going to think something's really happening medically. So most people will get treatment for that. But when you go to your doctor, if they determine that you're not having some sort of heart condition or something, then you need to seek treatment after that so that it doesn't continue to happen. Now this one, people are going to be like, come on now, April, it's been a pandemic. But severe weight loss or weight gain. And this is unintentional. I'm not talking about you snacking and tired of your kids and so you don't put on weight during the pandemic. I'm talking about really, you're just blowing up and you can't stop. Or you can't eat, so you're just getting smaller and smaller and smaller. You really need to see, I say, your primary care doctor first. And then if they can't find a reason for it, you definitely need to maybe see a therapist or a counselor to kind of address that. Seeing, hearing, or believing things that aren't real. And so if you believe that you are Barack Obama, unless you are, that's a problem. So, or if maybe you believe that everybody's out to get you, or you believe that, people are talking to you and there's no one else in the room with you, you really need to seek treatment. Again, because it could be medically related. So not everything we automatically go to, you need to go see a psychiatrist. You just need to go, especially to get the medical evaluated first, okay? Excessive use of alcohol or drugs. And again, a lot of people are going to say, I've been drinking wine a little bit more because I've been home with my kids, okay? And I think that everybody kind of understands the whole pandemic thing and what's going on. And I'm not really talking about that. I make light of that. But there are people who can't go through a day without some alcohol to help them get through. That is an indication that your coping skills are not where they need to be. And so you need to really talk with someone to develop those skills so you don't have to rely. I'm going to caution people, because abstinence, if you have built up a tolerance, which means that you drink more and more and more, if you just stop cold turkey, it really can have a negative effect on your physical self. There's severe withdrawal that can accompany just stopping alcohol. So cautiously, go see someone, talk to your doctor, go into treatment, do what you need to do to be safe and be okay. Drastic changes in your mood, behavior, personality, or your sleeping habits. I'm going to tell you, one of the first things that I know is when I'm working with people and they're not sleeping, full stop, go see someone. Because when you are sleep deprived, even if you don't have a mental health concern, or you will have one, if you don't get sleep, everybody knows that you get to a certain point, if you don't get enough sleep, you're going to start going off a little bit, okay? But if you are consistently not sleeping, you're tossing and turning, your mind is racing over and over, and this is going on for a period of time, you absolutely need to see someone, okay? And the same thing with your mood or your behavior. If you're the sweetest person as pie and all of a sudden you're angry and yelling and raging at people all the time, you might need to go see somebody. okay? Extreme difficulty concentrating or staying still. I talked a little bit about attention deficit disorder earlier on, but it's not just for children. It's something that can negatively affect adults as well. If you can't get your work done and you're about to lose your job, you need to go see somebody, because you don't want to make a simple situation really, really bad. So definitely take that into consideration. And then the last thing is intense worries or fear that get in the way of your daily activity. If you are so worried and so scared about the fate of the world, or about violence in the street, or about, and I am not negating, in this climate we live in, there's a lot of that going on. However, if you can't leave your house because you have so much fear, you need to seek treatment, because it can lead to a whole host of other things, okay? So again, these are signs that you may want to go ahead and see a professional. I'm going to talk about what that looks like. So as far as what treatment looks like, most people know about psychologists and therapists, counselors, or psychiatrists. And there is a difference between a psychiatrist and a psychologist. I know a lot of people use them interchangeably. A psychiatrist is the one who's really going to, it's the medical doctor that's going to prescribe medications and things of that nature, and really can, do the diagnostic piece as well as the medication management piece. Some people go to their primary care doctor for medications, and that's perfectly fine. But if you find yourself in a place where that is not working, what your doctor is prescribing isn't touching your symptoms, then you may need to make an appointment with a psychiatrist to get additional help, because they're specialists. It's what they do all day, every day, and they see every different kind of disorder. So it's really good to see a specialist when you need one. Treatment can occur in a lot of different settings. The one a lot of people think about are inpatient settings. So when someone is in the hospital for mental health issues, and people, they're hospitalized. And that's a very small number of people that experience mental health concerns, okay? Most people get treatment in the community, in their office, and something really big right now is teletherapy, which is you at home on your device and your therapist is in their office. Because of COVID, we got to make sure that we're doing what we need to do to stay safe. Otherwise, it's usually face-to-face, and you're working with a clinician, a therapist, or a counselor. And I use those names kind of interchangeably, but it's just based on their discipline and their training. So you can get that therapy, whether it's outpatient, inpatient, in an office. You may do it individually, where it's just you and the person who's providing your services. You may do it with your family if you're having relationship issues due to your mental health concerns. You could do it in a group. A lot of times people get great benefit from learning from others that are experiencing the same thing. Or, it could be a mix of that. You may do group 1 week and then do individuals for 2 or 3 weeks. And people get scared by feeling like they have to do therapy forever. And that's not true. I think that when you have the skills that you need to manage and cope with those things that you're dealing with, then you can reduce the amount that you see your practitioner. It doesn't have to be forever, but I think you also can go back and revisit it at any time, okay? So that's basically how treatment goes for mental health. You start out with an assessment, and that would be from a clinician, a psychologist, or a psychiatrist. And once they come and say, here's what we're seeing, these are the criteria that you're meeting. And everyone who diagnoses, you can't just diagnose off the cuff. You actually have to use the Diagnostic and Statistical Manual of Disorders, okay? So when you go to them, they take the information you provide for them and they come up with a plan, a treatment plan, and they make recommendations on what will be helpful for you, okay? So, you know what the warning signs are, kind of know what some of the diagnosis names are, you know what treatment kind of looks like, but I want to talk about some challenges specifically for the African American community, because I think that these are the things that prevent us from moving forward when we know something is going on. And so the first thing I want to talk about is socioeconomic disparities. Now, I know that everyone has heard in the news about, the health disparities that African Americans have, with this COVID virus. Everybody is hearing that. And now everybody's trying to get to the bottom of why are these health disparities out there. Well, the same goes for mental health. It's just nothing different. A lot of it is poverty. Sometimes people are impoverished and they do not have the funds. I know somebody may say, look, I got a job, I got insurance, but I can't pay that copay every week because I got to put food on the table. Or they may say, yeah, I don't qualify for any kind of Medicaid or Medicare or any kind of insurance. And so I can't afford that. I'm just out here trying to get it. I know for a lot of single parents, you may not be able to take time off work to go and get that treatment. And so that is a barrier. I think that everybody understands about the fights against the Affordable Care Act and trying to dismantle that, which is expanding coverage for a lot of people. And I'm not going to get political on it, but when people don't have the coverage, they don't get the treatment. And so that is a big challenge that we face in this field. The second thing that I want to talk about is stigma. Now, I don't know how many of you have heard somebody say, oh, she's just a little off. Just leave them alone, they fine. They don't need no help, they're just a little off. A lot of times we discount what people are experiencing. Or that's a white people thing. We don't get therapy, what do you mean? We don't have that luxury, okay? Another thing that I hear a lot of times is, look, you got Jesus, that's all you need. And I am fully a believer that Jesus is all you need. I also believe that he equips everyone with gifts and talents and ability to address concerns that you have. So don't look one blessing, don't push one blessing aside because you feel like I gotta power through this and I'm just praying and that's what's gonna get me there. Maybe your prayer leads you to somebody who actually can help you. And so I say your faith is always gonna be the basis of everything you do. Look for a faith-based clinician. There are plenty of us out there, okay? Or this is one that I think a lot of times I hear from the male clients that I have. That's a sign of weakness. I'm not fitting to go see nobody because they don't know what I'm struggling with. That's a sign of weakness. Only weak people gotta go get help for this. I'ma just get through it myself. Okay. For the children in the family, they just bad. They just need a whooping. They'll be good. No. A lot of times that's gonna make it worse. So I like to say that I've heard a lot of families, because I worked with families when I first started in the field, and I heard them say, all I have to do is take stuff away. All I have to do is spank them. And after doing that for a year or two, and it didn't work, it got worse and worse and worse, and then they had to see me, okay? So a lot of times it's not a substitute. Yes, you can discipline your children, hands down. You also can get treatment if it's beyond that, if you're not seeing anything. And then my all-time favorite, if you talk about it, it makes it worse, especially when people are talking about suicide or depression. Oh, don't talk about it because then they're going to want to do it. Well, I'm not going to delve into suicide because my colleague is going to be discussing that next Tuesday. So I encourage you to tune in for his presentation on suicide in the African American community, because he's going to unpack a host of information on that, okay? So I just wanted, these are some of the things in our community that are out there. These are some of the myths, some of the stigma. And as long as we hold on to that, we're not going to get where we need to get, okay? We're not going to be as whole as we can be. The last thing I want to address as a challenge to seeking mental health services is a bias, provider bias, and inequality of care. We all know that our system is very, very challenged. We know that there are barriers to service. There are barriers to treatment. We know that our symptoms are not always taken seriously, okay? And so finding a culturally competent clinician can be a challenge. Now, there are plenty of clinicians of all races and all shapes, sizes, male, female, gender, neutral. Hey, they're all out there. However, in the African American community, there aren't enough of us. And there aren't enough providing that treatment in the community. So it makes it a lot more difficult for people like me to sit down with someone like me. And so it is a challenge, but I don't think it is something that we can overcome. So I'm going to speak directly to those of you who are in school, who are provisionally licensed, who are starting out in the field fresh, and you want to go make all this money, or you want to go, I'm going to go do research for the rest of my life. I'm going to challenge you to step outside and really consider putting some time in your own community, because they need you. And with everything that's going on in this world, they need you. And so please, if you are starting out in the field, or hey, you've been in the field for a long time and maybe you don't feel like, now it's time for me to rest on my laurels, you might want to say, hey, maybe I can volunteer some time here. Maybe I can do a few evening services for those working moms that just don't have time. Okay? So that's my challenge to my colleagues and my future colleagues. Get out there and make a difference, because people need you. African Americans have a rich and complex history, and they have seen atrocities and oppression and violence and things that other people just don't experience on a regular basis. And they need to be comfortable when they go sit down and talk to someone. And I'm not saying that there are not other clinicians that are culturally competent. But I know I feel comfortable when I talk to somebody who gets me. Doesn't mean that somebody else can't get me. But you want to be comfortable. So seek treatment from the person that you'll feel comfortable with. And that would overcome that challenge. Now, recruiting and getting other people to join these organizations, to have more psychologists, more black psychologists, more black psychiatrists, that's something that I think we just need to teach our kids, that you can be that, so that the next generation has more choice. Okay? Talked about a lot of stuff. And I feel like the time has gone by pretty quickly. I don't know about you. I hope it was educational. But I want to end on a positive, because it's real easy to talk about all of the things that don't work. And it's real easy to talk about the heaviness of this subject. But African Americans are resilient people. We have overcome so much in our life. We have overcome every day. Most people, when you go out there to work, trying to stay out of the criminal justice system, trying to keep from, having negative interactions with the police, trying to just live your life without being censored. That's tough, but we always persist. And so I want to, number one, encourage all of you. You put the time in tonight to learn more, and I appreciate you spending the time with me. And I honor the resilience of our community. I also want to say that mental health wellness is something that it's almost hard to quantify. It's something that, it's not just saying that, oh, it's an absence of having any kind of mental illness or mental health concerns. It really is that you're learning how to function. So maybe you still have some depressive symptoms, but you know when you need to get help. So maybe you've developed the skills to be able to help not only yourself, but somebody else. And so that's wellness. You don't go to the doctor every day just because. When something's going wrong, you go see a doctor. Well, I want you to do the same thing with your mental health. When you see something's off, go see someone. Go talk to someone. Start with your primary care doctor. Because like I said, a lot of things start with medical. And if you don't address the medical, it could be something that's very simple. So last, because I am a health coach as well, I think you have to look at the fact that wellness includes a lot of things. Make sure you're sleeping well. Make sure you're eating well. Right now is a tough time because finances are tight for a lot of people. And so try to find sources to make sure you're getting food and that you are feeding your brain, because that can set you off as well, okay? So I want to make sure you get sleep. I want to make sure you're eating. I want to make sure you're getting exercise, because exercise can lift some of those good chemicals in your brain and really make you feel better. I'm going to tell you something. It's to the point where when I start getting stressed out and frustrated and things just aren't going my way, my daughter will look at me and say, "Ma, you might need to go take a walk." And guess what? It works every time. It's not going to fix everything, but it really does help. Stay healthy and just make sure that you're doing what you need to do to be healthy in your mind, your body, your spirit, in your community, in your family, okay? Because mental health is going to encompass all of that. So I thank you for joining me, and I ask you to stay tuned on Facebook Live for our question and answer session right after this.